How do you know if you're at risk for cervical cancer? Understanding your risk for cervical cancer is essential for taking proactive steps in your health. Cervical cancer primarily arises from persistent infection with high-risk types of human papillomavirus, commonly known as HPV. Most sexually active women will encounter HPV at some point, but not everyone will develop cervical cancer. However, certain factors can increase your risk significantly. One major factor is having a persistent infection with high-risk HPV types. If your body struggles to clear the virus, your risk of developing cervical cancer rises. Women with weakened immune systems, such as those living with human immunodeficiency virus or those on immunosuppressive medications, are at a higher risk. Their bodies may not effectively fight off HPV infections. If you have a history of cervical precancer or previous cervical cancer, your risk is also elevated. This includes having been diagnosed with high-grade cervical dysplasia or other HPV-related cancers. Such a history often requires more frequent screening to monitor your health closely. Starting sexual activity at a young age and having multiple sexual partners can also increase your risk. These behaviors raise the likelihood of HPV exposure. Additionally, sexually transmitted infections like chlamydia may contribute to cervical cancer risk by promoting HPV persistence or causing inflammation in the cervix. Reproductive factors play a role too. Women who have had 3 or more full-term pregnancies or who had their first full-term pregnancy before age 20 may have a higher risk. This could be linked to hormonal changes or immune responses during pregnancy. Long-term use of oral contraceptives has been associated with a modest increase in risk. However, this risk tends to decrease after stopping the pills. Socioeconomic factors and access to health care are also crucial. Women with lower socioeconomic status or limited access to regular cervical cancer screenings may face a higher risk due to delayed detection. In rare cases, in utero exposure to diethylstilbestrol, a medication once prescribed to prevent pregnancy complications, is recognized as a risk factor. If you identify with any of these risk factors, it is crucial to consult with a healthcare professional. They can guide you on appropriate screening schedules. Routine cervical cancer screening should begin at age 21 and continue regularly until age 65. This includes Pap tests and HPV testing, which are vital for early detection. In summary, knowing your risk involves understanding your HPV exposure, immune health, reproductive history, and access to health care. Discussing these factors with a healthcare provider can help you determine your individual risk and the best screening plan for you. Taking these steps can empower you to manage your health effectively.